So the next question is, would it be beneficial to split into the semaglutide instead of one shot, especially when the dosage goes up? Absolutely. When I say beneficial, I'm I mean, semaglutide works. We know that. I've talked about it before, and so does tirzepatide and any of these GLP-1 antagonists. But the the biggest and actually the only side effect that I've witnessed in my practice anyway, I've read about the others, but the biggest side effect is nausea. And it's related to the titer that's built up, and hence the reason why the instructions are to start low, work with that dose for at least a month, which is involves a weekly subcutaneous injection, and then double that for another month until you get used to it, and in that way avoid the nausea. Well, some people can't dodge it anyway.
Right.
They're sensitive to it, in which
Right.
case the is okay. Well, let's reduce the weekly dose and see how you do.
Yeah.
The other way to approach that, though, is to, as this suggests or asks, divide the dose so that you might do a Monday, Thursday injection instead of a once per week, but of half of whatever dose you're
Right,
supposed to be
right.
using that week. And yeah, most definitely that is one way of doing it. It's not my first choice simply because from what I've seen, the nausea created by this potentially is not. It's and not that any nausea is pleasant, but this is like it's suffering.
Yeah.
So I want to avoid it at all costs. And so if I know a patient well enough where they tend to be sensitive to certain drugs, and you never know, it can be sensitive to some and not others. But if they don't necessarily have a high pain threshold or for any reason, I mean, why would you want to endure it? But start with a lower dose to begin with.
Yeah.
And what's the rush? You'll get some benefit out of it, and if it is postponed by, even postponed by a month, okay, well, whatever. I mean, I understand if you got a wedding to go to and all that kind of stuff, but for the most part, just take your time and avoid the nausea altogether. But that is one method of trying to avoid it, and it's not necessarily going to give you any less or more result in terms of being efficacious, but it can dodge what I see as the major side effects.
Okay. Awesome.
So I guess I don't know if this is the same person or not.
Yeah,
the last
same person.
One, JW?
Yeah.
Okay, so JW asks, when using semaglutide, if the body fat gets really low for a bodybuilder, will it make you more nauseous? Interesting question, because I'm not sure how that would be related, but still a great question. In my experience, no. And in my research, I mean, I don't know of anyone who has published anything that suggests that might happen, because the nausea isn't created by the amount of body fat.
Oh, no, it's not rated? Okay.
No, the nausea is typically, I mean, from our current understanding, related to the stomach contents staying put, as it were. So one of the reasons why this helps with weight loss is it tamps down on your appetite so well, because the food stays in your stomach longer. And obviously, if something stays in your stomach longer, I mean, one of the reasons why you don't go jumping up from the breakfast, lunch, or dinner table and hit the gym or something is because, you got to wait for the food to digest. It's uncomfortable. Things are being mobilized toward the stomach and the intestines to make use of that food. So it's not the best play. And therefore, you can become nauseous because, if you force yourself, for example, to go to the gym anyway, the body says, okay, well, I got to choose here.
Yeah.
And I'm doing, heavy squats. I'm going to jettison what's in the stomach because
I can't do it.
I can't do it. Yeah.
Yeah.
Duh, right? And I mean, we've all experienced nausea for one way or the other. Even, if you don't have food in your stomach and you push too hard, your body's like, it's so used to saying, okay, let's throw this stuff out. And even if there's nothing there, it's still trying to jettison it, and we get the dry heaves, right? But one of the things to consider, since we're on that topic, and this is the second question related to, I made it related to nausea with the one before. Choosing what you eat is probably way more important than, what he's asking about here, which, again, a great question. But no, I don't see any relationship. But if you're eating something that's really greasy, fatty, if you're eating something that might have an exceptionally high amount of fiber, which could expand more in the stomach when it's hydrated, maybe even more, because of the way the semaglutides and the others work, it's staying there.
Yeah.
And it might make you feel nauseous for that reason. Plus, not only is it staying there, some reports say, you might have food in there for longer than 24 hours. Which,
Wow.
I mean, I wouldn't want that, but I don't think anyone necessarily does. But anyway, it can happen. And, think about certain type of carbs. Like if you eat something that's way too sweet, it can start really fermenting in there, if you think about it, right? Anything that might cause gas, in other words, could also make for more of a problem in this nausea. So, you want to be thoughtful about what you're eating. And also the obvious is don't overload it. That's one of the big complaints is that people get, who are especially guys that love eating, if they were taking this stuff and they're like, I got it. It's not about energy. I just want to really enjoy that entire ribeye. Well, then it's going to be sitting there a while, and then you're going to be paying for it in that regard. So just considerations when you're using the semaglutide. But man, I don't think the amount of fat you have or don't have has any relationship to it.
Good to know. Thanks, Doc.